and welcome. My name is Rick Forlano and I'm the Executive Director of Arthritis and Osteoporosis WA. At Arthritis and Osteoporosis WA, we have recently received a number of questions from parents of children with arthritis who have particular concerns about COVID-19. Today, I'm joined by Dr. Pavla Walsh, who has kindly given her time to respond to these questions. Dr. Walsh is a paediatric rheumatologist and pain medicine specialist. She works in the public system at Perth Children's Hospital and also privately at WA Specialist Pain Service in Cottesloe. Dr. Walsh, thank you for giving your time to assist our consumers today. Could we please start with a brief overview of COVID-19 and its relevance to the immune-suppressed child with rheumatic disease?
Good morning, and thank you for inviting me along to talk today. So look, I think there's probably not very many people who aren't already pretty aware of COVID-19 and what it's been causing in the world. But I thought it might be even worth our while just taking a little step back and talking very quickly about what viruses are in the first place and how that puts it into context. So most of us are aware that infections in humans can be caused by viruses or bacteria. And of course, we treat bacterial infections with antibiotics. But viruses are a bit different. So bacteria are cells that can reproduce in the environment or in people, or indeed any other animal or in plants. And they can survive on their own. They have cell walls and membranes. They can produce energy. They can reproduce without necessarily having to have a host in which to live. Viruses, on the other hand, are 100 times smaller again, and they are little tiny particles of genetic matter that can exist in the environment. Once they make it inside a host's cell, they hijack the host cell in order to allow themselves to reproduce. So they are parasites. They must have a host before they can survive and reproduce at all. Viruses can survive outside of a host, but they can't reproduce. So coronaviruses have been around for a long time, and we've recognized them for many decades. They're very common. About 15% of the common cold is usually regarded as coronaviruses. In humans, they are usually relatively minor infections, so upper airways, so the back of your throat, your nose, etc. Typical cold. But in animals, they can also cause gastrointestinal symptoms, so diarrhea, vomiting, etc. Prior to 2019, there were two main coronaviruses that caused different disease in humans, and both of those hit the headlines in their day, so SARS and MERS. Now, SARS and MERS were both important because they didn't just infect the upper airway, they could hit the lower airway too and cause pneumonia. And consequent with that, those two viruses had quite significant death rates. Now, as everybody knows, in late 2019, there was a cluster of pneumonias in Wuhan in China, which was eventually identified late in December as being from a new coronavirus. And that's been called COVID-19, so novel coronavirus 2019. And since then, it's spread around the world and so has reached the criteria to be called a pandemic, which is to say there are cases being transmitted person to person in multiple countries around the world. As I said, coronaviruses are a very large family. There are multiple versions of it that can infect humans. Importantly, this is a type of virus that has an envelope around it. So we've all seen the pretty pictures, and it looks like a soccer ball with spikes attached on the outside. The soccer ball part is actually a little bubble of fats that protects the small virus particle when it's out and about in the world. The little spikes are proteins on the surface that let it hijack its way into a cell. The existence of that soap bubble of fats is actually quite important because if we can disrupt that bubble, if we can get the bubble to break up, it makes the virus very vulnerable and it is destroyed fairly easily. That's why we talk about washing your hands with soap and water for 20 seconds. It's to try to disrupt that bubble of fat. That's why the high alcohol hand rubs are useful, because they get rid of that bubble. So just washing your hand with water, not so good. Not washing your hands at all, not very useful. Now, what else can I tell you about this? So most coronavirus 19 infections, as far as we can tell at the moment, are actually relatively mild. So a certain proportion of people clearly may catch the virus and be shedding the virus without any symptoms that they have recognized at all. We're not certain precisely what proportion of people that is. For everybody else who catches the virus and gets symptoms, the vast majority actually have very minor symptoms. They're a bit of a sore throat, sometimes a bit of a runny nose, a dry, irritating cough, etc. In the second week, a certain proportion of people who then have coronavirus will go on to get more significant trouble. Now, these are the people we think for whom the lung symptoms are more important. So shorter breath, can't catch your breath, tiring easily, and when we put the oxygen monitors on, the oxygen levels are dropping down, etc. Overall, it's the relative minority of people who get into serious trouble, who end up needing to go to hospital, and who end up needing serious support, so high flow oxygen or intubation, etc. But obviously for those patients, this is a very serious disease. We can play the odds. We know that certain people are higher risk, and that's been identified as people with chronic disease, I'll come back to that in a second, and people who are over a certain age. So they say the 70s and up is a higher risk, but having said that, there are plenty of people in the world who are younger than that who have caught it, and there are plenty of people with no recognized previous diseases who have developed coronavirus infections and been seriously sick. So the definition of chronic diseases, which seems to be associated with the higher risk of bad outcomes in COVID-19 infections, is actually relatively small. It's pre-existing heart disease, chronic lung disease, people with cancer, and people with chronic kidney disease, and people who are on medications for high blood pressure. Poorly controlled diabetes is the other group that are specifically named. Now, what's important to us here is that the people who are not named are people with chronic rheumatic diseases and people who are on medications for those diseases. So that's actually pretty important. It's been very interesting for us as rheumatologists to watch this. Initially, as the news was breaking as to what was going on, we were quite concerned because, of course, we have many of our patients, adults and children, who are on immunosuppressants. Ordinarily, we would be quite worried that a new virus coming through the community was going to produce serious adverse outcomes for our kids. However, it doesn't seem to be the case, which is very encouraging for us all. We continue to watch the situation, of course, and there's an international effort to report the outcomes in patients, both adults and children, who have arthritis, lupus, etc., and who are on medications to treat those. But what we've seen is that children certainly get infected, but they don't seem to have the high rates of serious disease. They are very underrepresented in the number of deaths from COVID-19 infection and its complications. What we're also not seeing is a huge number of patients on methotrexate having seriously bad outcomes, or people on the biologic agents who get into the infections. Generally, they're doing pretty well.
Thank you for providing that overview. You spoke about immunosuppressants and COVID-19, and we have received lots of questions exactly about that. Firstly, would having a suppressed immune system decrease the likelihood of serious symptoms, considering that some serious cases are possibly caused by an increased immune response?
And that's a really good question. As you say, it appears that one of the major issues in COVID-19 infections is not even the disease caused by the virus itself. What we see in the second week is possibly an overreaction on the part of the immune system a cytokine storm. Cytokines are chemicals released by the immune system trying to gain control over an infection. And sometimes the release of cytokines becomes part of the disease itself. So you go from having an appropriate immune reaction with appropriate inflammation to suddenly a runaway, freewheeling cytokine release. And that seems to be part of where we see the trouble. So widespread clots, we see patients therefore who have high fevers, who have this terrible lung disease, etc. And as you say, it appears to be the immune reaction overreaction. Now we see this in some other diseases. So there's a condition in rheumatology called macrophage activation syndrome, and which is referred to in hematology and oncology as hemophagocytic lymphohistiocytosis. This is a situation where the interplay of genetics, bad luck, infections, etc., can actually lead to this freewheeling immune reaction, and it can be quite serious. We think that that's part of what may be going on, a similar process, in that second week of COVID-19 infection. Now, it's very early days yet, and there have been some attempts made to decide if some of the rheumatology drugs could actually be useful. I think we've all heard the story about whether or not Plaquenil, hydroxychloroquine, could be either protective against COVID-19 adverse effects, or in patients who are very sick, whether it could be of benefit. Now, as I say, it's very early days. At this stage, the advice is officially, we're not quite sure. So there are ongoing studies that have been fast-tracked and are being used. The preliminary data is not suggesting that hydroxychloroquine specifically is some sort of magic bullet. So it doesn't look as though it's a medication that's going to be a magic fix. Similarly, for most of the other medications that we're talking about, we simply don't have that data. There haven't been enough patients affected badly for us to make the decision whether it is protective. And there haven't been enough patients treated in the situation of bad COVID-19 disease for us to have a really clear understanding whether our drugs are useful. There have been single case reports or a handful of case studies reported, but no true trials that could let us really know if it's worth using that treatment. There are other treatments being used and trialled, of course, supportive measures, naturally, intubation, etc., kidney replacement with dialysis. But taking very sick patients and giving them, say, tocilizumab, we just don't have the numbers yet. The theory sounds like it should be good, but we don't know. So the advice would be, if you think you might be at risk of getting COVID-19, there's probably not much point going out and sourcing something like Plaquenil to try to take it to keep yourself well, because we don't know if it'll work or not, and you're exposing yourself to side effects.
Okay, thank you, Pavla. How would COVID-19 affect children with JIA on biologicals, DMARDs or NSAIDs?
Another very fair question. At the moment, the answer seems to be it affects them the same as other kids. So the children with JIA as a part of their inflammatory disease are not at particularly high risk. We've got no reason to believe that having arthritis is itself a risk factor for catching it or for developing bad disease. Being on methotrexate or other biologic agents doesn't seem to be a risk factor, and we don't know if it's a protective factor either. NSAIDs is a good question. I'm certain most of our listeners will have heard a rumour going around that anti-inflammatories could be something that makes the disease more severe. Now that had its origin, in fact, in mid-March with one of the French health minister, I believe, who published a comment saying that it appeared that ibuprofen, so Nurofen, was possibly associated with a worse outcome. Since then, people cleverer than me have gone back, looked through the data, and come back essentially saying, look, we've got no evidence to support that. It's possible that they were looking back at some of the evidence in chickenpox, where using anti-inflammatories rather than Panadol or paracetamol can have a nastier outcome. But in COVID-19, we don't have any evidence that anti-inflammatories cause trouble. At the moment, the advice would be keep taking your medications as they're prescribed. If you need to use anti-inflammatories for symptom control of your arthritis, use it.
Okay, thank you. As a parent of a child who is receiving rheumatic infusions, should I be taking extra precaution given the COVID-19 pandemic?
I think it's possibly worth just revising very quickly what the normal precautions should be. Now, realistically, in Australia and in Perth in particular at the moment, we have very few active cases. That's wonderful news for us, and kudos to everybody who's been doing their part with social isolation for the last month. So in Perth, in Western Australia at the moment, the chances that any one person going about their usual daily activity encounters somebody else with COVID-19 who is shedding the virus is actually pretty low, thank goodness. The standard precautions that we're all currently being asked to do fall into two categories. The first is try to avoid contacting the virus itself. So try to avoid bumping into lots of other people. This is where the social distancing comes in. So we're advising that if you don't need to go outside and mingle in public, don't do so. If you do need to leave the house and go amongst other people, so to do the shopping, to go to work, etc., then try to maintain a decent distance between you and the next person. The number quoted is 1.5 meters, which isn't that far. If you can touch them with your hand, you're too close. The third comment that then is being made is, if you are out and about mingling with other people and you need to cough or sneeze, please do it in such a way that you don't shoot spit and virus particles all around you if you're infected. So cough or sneeze into your elbow or into a tissue, and then go back, wash your hands as quickly as you can and thoroughly. So either the high alcohol content hand gels or soap and water for at least 20 seconds. The second set of advice then is based around if you are potentially in contact with COVID-19. So you've gone outside and you've had contact with other people, what do you do? There is a large and heated debate as to whether or not people should be wearing masks. It's a fair question. Now, there are different grades of masks. I'm not going to go into that today because that would take the rest of the session. If you think you might have a cold or a flu symptom of any sort, you should probably be staying inside the house if you can. If it is essential that you go out, so for example, you're going out to get swabbed to be checked for COVID-19, they advise that people try to wear a mask. That's to try to avoid accidentally leaving snot or spit all over the place. Wearing a mask when you go out, if you're feeling well, is debatable. So, if you're trying to avoid possibly shedding the virus, that is one reason to wear a mask. And there is an argument in favour of that. But if you're wearing a mask and you take it off and on repeatedly and you're handling the outside of the mask, etc., you may have just gotten rid of the whole point of wearing the mask. If you're wearing a mask to try to avoid spreading the catching the virus, then you actually need to have a properly fitted high-rated mask that you put on and take off in a very careful fashion. And most of us don't really know how to do that. However, practical advice that we can give to everybody is, as I said, hand washing carefully and thoroughly. It's wiping down surfaces with alcohol wipes. So if you're sharing a computer, wipe down the surface before you start. If you're picking up a phone, likewise. If you're outside in public and you've handled things and then you handle your phone or your keys and so on, wipe them down again. Assume that any surface that you contact outside in the larger community could well have particles of the virus lingering on the surface.
Good, thank you. Thank you, Dr. Walsh, for answering those questions about medication and children living with musculoskeletal conditions in times of COVID-19. Now for our viewers, we have split this Q&A into segments so that we can select and view the areas of most interest to you. So please join Dr. Walsh and myself again for part 2 of this Q&A session, which we will explore the comorbidities and COVID-19. Thank you.